Would you be surprised if I told you that the new American health deal that's sitting on Zambia's table right now isn't just a financial trap, it's a political hostage situation tied directly to our upcoming elections. Welcome to the Zambian People's Pulse. My name is Tanya Malama Fuchs, and I have one job: to make you think. Let's think deeply about what is actually happening in our country. Let's look back exactly 1 year following the sudden executive order from Trump's administration, where the critical US assistance was abruptly frozen. Okay. The impact here in Zambia hasn't just been severe, it's been quite scary in some places. According to global health journalist Andrew Green, who's been reporting on the ground in rural Zambia, these cuts haven't just hurt daily treatment, they've completely shattered our early warning and testing and outreach systems. And because of this, public health models are now warning that if this funding gap isn't closed, we won't just see a slow, gradual rise in HIV. We could be on track to see a surge in new infections over the next 3 to 5 years. And what does an explosion of new HIV cases actually mean for our country? It means a critical, systematic collapse of our medical infrastructure. An escalating HIV crisis will completely overwhelm our local clinics, and it will wipe out the productivity of our young workforce, which we all rave about as a country. We have a young workforce. And treating late-stage infections will create an astronomical financial burden that will probably break what's left of our economy. Today, our healthcare system is already financially bleeding. Let's look at the actual numbers. In the 2026 national budget, our government allocated 26.2 billion kwacha, roughly 1.1 billion US dollars, to the health sector. Keep that number in mind. A massive portion of that is desperately needed just to pay the basic salaries, fund the targeted recruitment of 2,500 new healthcare workers this year. But here is the terrifying health reality, okay? According to the recent budget analysis, Zambia still faces a massive 21 billion kwacha financial deficit just to meet basic international healthcare standards. That 21 billion kwacha gap is exactly why you go to the local clinic and find stockouts of essential medicines. It's why your doctors and nurses are burning out from being grossly overworked, understaffed, underpaid, and doing double shifts. And the crisis has now reached the highest level of government. Just a few days ago, President Hichilema abruptly fired our Minister of Health, Dr. Elijah Muchima, and the timing, I was suspicious. It happened right as public pressure mounted over the new US health deal and our mining concessions. Put the two together. But what wasn't made clear to the public a year ago is why the US cut the aid in the first place. That executive order wasn't just about saving America's money. It was a brutal negotiating tactic. By cutting our financing, they were wiping the slate clean so they could enforce their new America First strategy onto the table when we were desperate enough to renegotiate. So what are the terms? The US is offering roughly $1 billion over 5 years, but that money is directly tied to a separate bilateral compact, granting them access to our critical minerals, and specifically copper and cobalt. And furthermore, they're demanding access to our sensitive health data for up to 25 years, even though the funding only lasts for 5 years. And as we all know, it isn't free. Under this new deal, Zambia is expected to contribute roughly 340 million of our own domestic financing just to unlock their money. And here's the most important question that nobody's asking. Why does the US think that we're desperate enough to sign this agreement right now? Well, the answer is the August 2026 general elections. The US negotiators have set a strict, hard deadline of April the 1st for Zambia to sign this agreement. What do they know? They know our incumbent government is under massive pressure. They know that if the government goes into an election with a collapsing health system and 21 billion kwacha deficit, the political fallout could be catastrophic. The US is weaponizing our democratic calendar. They're essentially saying, sign away your copper and your cobalt and your data now, or go into your elections explaining to your voters why the hospitals are empty. But what if Zambia pushes back and wins? What does a real solution look like? The US is offering roughly $200 million a year. But if we want to fix our healthcare system and pay our medical staff properly, the answer isn't a predatory foreign deal. The answer is our own economy. If we can optimize our own tax collection, close corporate loopholes, and stop giving away our mineral wealth for pennies, we could close that 21 billion kwacha gap quite easily ourselves. We wouldn't need a foreign power's money to keep our clinics open. Why is it that the government is even considering giving up our rare earth minerals to secure an agreement that has absolutely nothing to do with our healthcare? Because it's leverage. The Americans are using leverage against us. If we're truly as rich as the world says we are, then it's time we start building the systems that allow us to fund our own survival. Until the next one.